So we're actually a US-based social enterprise. We provide resin-based technologies, and I'm not going to talk too much about the technical innovations because we actually have a session that's going to be spoken with our India-based director, Dr. Prasoon Chatterjee, in the next session. So I'm going to touch more on our operating model and the management model. And so to do that, I first have to take you back to 2012. I was a lot skinnier then, and basically true to form actually in the program, there are 2 letters before my name that are inaccurate. I'm actually not a doctor, I just have a bachelor's in public health. But I will say that the moment I saw the typo, I sent the photo to my parents in Dallas, and it was for that slight second the happiest moment of their lives. So thank you, organizers, for that. But the 2 other co-founders are actually PhDs. So Dr. Roop Sengupta in the center is from Lehigh University. And then Mike German is now a PhD student, sorry, he's now a PhD graduate whose PhD was actually on commercializing our ion exchange technology. And this all started actually in Binimoypara, North 24 Parganas, West Bengal. And so back in about 2005, Dr. Sengupta started working with an ion exchange resin that selectively absorbed arsenic-3 and arsenic-5. In Binimoypara, there was raw water of about 200 ppb, which is about 20x the World Health limit. And over the course of about 2 years, he had the same resins basically run and consistently provide safe drinking water below the 10 ppb. Then he did regeneration, and then again it was possible to run for a second cycle with similar results. All the while, the revenues actually over the course of more than a decade grew 3-fold. And so now the system's still operational, it's been running for more than 15 years. And with that kind of confidence and conviction, in 2015, we received a grant from the US India Science and Technology Endowment Fund. And what that allowed us to do is see how we could manufacture this resin locally in Kolkata and also get into fluoride. So we first started working in Nalhati, Birbhum district, where we saw actually to what we believe is the highest level of fluoride in the world, 18 milligrams per liter, whereas the limit's 1.5. And there we were able to actually run the resin for a year and have it meet under the 1.5 milligram per liter level, do another regeneration, and then have it go for about another year. And what that did is it gave us the confidence to say, okay, we've got the technical validation squared away. How do we now scale it up as a commercial entity that can provide safe drinking water to as many people as quickly as possible? And so we ended up settling on this 4-stage operating model. So we set up a company, it's a US-based impact investment kind of recipient company that has a first stage of site selection. So we'll do water quality testing, we'll choose who the entrepreneur is, we'll then build a system, and what we realized is there's no one size fits all. So some areas might need a tabletop domestic filter. In Barasat, we actually got a piped water system that's operated using our technology. It's about 92 meters cubed per hour. And then more traditionally, what you've seen a lot of presentations earlier today and yesterday on were community systems, anywhere between 1,000 to 2,000 liters per hour. Once you build that, we have, again, something you've kind of heard about yesterday, which is this committee model where you've got a committee operating the system. 40 to 60 peso per liter is the typical price. And then we do on-site regeneration if the system's large enough. It's about 92 meters cubed per hour. It makes sense to have it on site. Otherwise, we do centralized regeneration. And then the other thing we realized is as you're working with entrepreneurs, you have to really handhold them. So we have a central control room. This is actually a photo underneath the maintain of our control room in Bangladesh in our Gulshan office, where we have a real-time view of over 140 systems we have operational in Dhaka City in partnership with Dhaka Wasa, the utility. And whenever there's an issue, we actually deploy our own payrolled service engineers, and we'll do an annual maintenance contract. That way we leave it to the entrepreneur to figure out the pricing, the marketing. What we want to do is basically own the maintenance piece of the pie, as that is what we see as the biggest issue for scale. Now, in terms of how far we've gotten from 2015 to 2020, early is basically we've got our technology now that's manufactured here in Calcutta. We've got CSIR certification. We've got the empowerment of the RI Mishalkar Committee. We have certification from the Arsenic and Fluoride Task Force in West Bengal. And we've now gone to market in partnership with Tata Trust in Assam. We've also worked with Clinton Health Access Initiative, so I'll double click on that for this talk and do a deeper dive on that case study. But what I do want to mention here is that over 300 systems deployed, over 3 lakh people served. We're also working in Bangladesh, and we're what we're finding very interesting is working with utilities directly, working directly in partnership with the government. That I think is the recipe for scale because these guys have the infrastructure, they just don't have the execution ability. So if we deep dive on Madhya Pradesh, CHAI is an interesting partner. Clean Health Access Initiative focuses squarely on nutrition. Last year they decided that water is a good part of the equation that we're missing out on, and when they looked at the levels of anemia, they found a strong correlation with high levels of fluoride. And they found that there was a lot of mottled teeth within school children due to dental fluorosis. So then they decided that they wanted to actually get into providing safe drinking water. So what we did is, there was a site where the raw was 3.3 milligrams per liter, and we actually had a consortium of stakeholders come together. So IKEA Foundation was kind of the donor for CHAI, along with Tata Trust, who provided the CapEx. But we also had a farmer entrepreneur who got a no interest loan from the state of Madhya Pradesh to help spur rural entrepreneurship. That helped give skin in the game for him, and then what we were doing was really just providing the technical support, and Engineers Without Borders also provided a third party. But then what was really great was CHAI had the ground force to do a lot of the software around awareness, around demand generation, which is what we found to be a critical success factor. And so now that we've got the system going, it was about November 8, 2018 when it first launched. To date, we've got about 3,500 beneficiaries. About 9.5 lakhs of water liters of water have been sold. Interestingly enough, the utilization rate's only 43%, so that means there's a lot left in terms of marketing and capacity. We've got about 6.57 lakhs of revenue, meaning the entrepreneur should break even within 2 years. What we really like about this model is that he took his own skin in the game by taking out a loan. And then what's also interesting is when you look at impact, 75% of our recovery of revenue was possible. The only 25% that's left is for the real low-income people, because see, the truth is, prepaid water meters are very difficult for the lowest rung of the pyramid. And so the revenues might look great, but collections is a whole other thing. And water ATMs seem very promising, prepaid water. But if you're really trying to address the lowest of the low, you really need to have flexible working capital cycles and flexible cash flows. Otherwise, it's very difficult. And so kind of zooming in on demand, largely driven by households. But what we see is that there's a large opportunity to provide safe drinking water to the Anganwadis, to government offices, special events like weddings. It's now wedding season, so that's a really good spike. And effectively what we do is look at how can we have more institutions provide the demand pull by doing a lot of marketing. And effectively what we've done is there's a paper published on environmental science and technology that talks about a lot of the work, not just on fluoride, but also arsenic, around how this is sustainable, not just from a technical perspective in terms of doing regeneration, but also more importantly from a revenue generation perspective, in terms of recovering your operating costs, in terms of even the holy grail one day of actually potentially doing some type of CapEx recovery. It's a bit controversial. I don't believe that you should do full CapEx recovery because we ourselves, living in urban India, living in urban US, don't actually pay for full CapEx recovery when we pay our own water bill. So how fair is it to expect that of low-income people? So I think ultimately there needs to be some kind of a blend. And so we've got a lot of content online on our website that does a deeper dive into this. We've got case studies. The World Bank's done some interesting work on our model in terms of how it's a public-private partnership. And ultimately, the first two lessons I would say are more micro level about the system. How do you drive demand? How do you have control center-based servicing where it's like a hotline, just like a customer service line? That's the type of handholding you really need. But I think on a more macro level, CapEx financing is obviously the name of the game. I go to these conferences, you go to World Water Week in Stockholm, and everyone's always begging for CapEx dollars from donors, from CSR firms, from philanthropic funds. And I think what's really important is we see how we can leverage the Jal Shakti's commitment of 3 lakh crores and crowd in more public sector capital, because that's the only way we can reasonably solve this issue. And I think when you do that, what's potentially possible is a blended capital model where you say, hey government, there's what's called the L1 mentality. So if you're the lowest bidder, you win the contract. And I think what's really promising is, I think a lot of folks are realizing and waking up to the whole build, decay, rebuild infrastructure financing philosophy that has plagued not just South Asia, but even parts of Africa. And how can we move away from that and have more of an outcome-based funding mechanism where maybe we crowd in private sector capital, we get 0% interest loans from the entrepreneurs, and then effectively tell the governments, hey, you know what, you've got all this money earmarked for CapEx. Why don't you actually use that for OpEx? Make it a quarterly based payment where if I hit certain metrics on water quality, on impacting X number of people, then you can pay it out. It's it's called a hybrid annuity model. Actually won a World Bank Financing Award last year. We're really excited. We think that has some promise. We're already doing this model in Bangladesh. And I think, you know, when you come to OpEx financing, right now what's happening is you've always got the people, right now, like for example in Dhar, it's 13 rupees for 20 liters. Government typically recommends like 5 to 7 rupees. So there's obviously a delta, there's a viability gap. And so there's a mix, right? So you have the entrepreneur kind of saying, I need to charge this much to make my money, maybe I'll get the tariffs to cover X%, Y% the government will cover. That's kind of interesting, but the issue is when you get into receivables and collecting money from the government, there's a lot of issues, receivables-wise, in terms of dealing with corruption and bureaucracy. So what we found that's very promising is why don't you have the government actually put that money into escrow so that once you hit certain kind of metrics, you can actually withdraw the funds from an independent party. I think these are very interesting kind of models that could potentially solve this problem once and for all. And I wanted to end with a quote. I would say, the quote summarizes all of my learnings over the past probably 8 years. It's by Indira Gandhi, and it says, my grandfather once told me that there's two kinds of people. Those who do the work and those who take the credit. He told me to try to be in the first group because there's much less competition. Thanks.
Thank you very much, Mr. Chowdhury. And it's a wonderful presentation. Like after discussions on arsenic contaminations, and first time now, you just added value, the fluoride contaminations. And we have scholars over here, Dr. S.P. Sinara, the fluoride specialist, and Professor Gupta, mitigations for fluoride contamination. So I'm sure that they will add more suggestions and value with the projects. Thank you very much. Thank you.
Thank you.